our bodies don't heal in 24 hours. So is Nuvia's process rushing things? Like, how can this process still be safe for the patient?
From the moment that a patient starts their treatment care with us, we are already collecting information. Some of that is medical information, making sure that they're going to be, optimized and be able to tolerate the procedure from a medical standpoint. And, there's nothing more important than safety, obviously. And then there's a lot of information that's acquired in terms of their facial proportions, where their lip goes in a smiling position. The smile is actually designed ahead of time with input from the patient and then also input from our doctors. And decisions are made ahead of time so that basically prototypes of the smile can be ready. And then once the surgery happens and the implants are in place, and we know exactly what angles those implants are at and what locations they're at, then the information of the teeth that's been pre-planned can be fused with the information of where the implants are. And then the lab has everything they need to work overnight, milling the teeth out of zirconia. So everything's ready by the next day. And then to answer your question, healing still happens, but it's now happening with a very strong final bridge, splinting the implants together. We talk about cross arch stabilization, and also, how good is that stabilization? You can stabilize something with a material that might flex, and that stabilization may not be as good as stabilizing it with a bridge that is not going to flex nearly the way a softer material might. So we create a setup, and of course we respect the biology and the anatomy during surgery, and then we have a setup that is ideal, in my opinion, for healing. And that, combined with our very talented surgeons across the country and the way that they do things, our very talented restorative doctors, our very talented anesthesia providers, our very talented laboratory teams. Everybody works together on the clinical front to make sure that everything is designed to be as ideal as possible. And that all translates into these very high success rates of healing.
So what you're saying is there's not just like one person, kind of trying to do everything at once, because I've also heard where like, hey, during surgery, a doctor can be giving, maybe anesthesia and also, pulling the teeth. And that's not what this is, it sounds like.
Right. Yeah. So, this is something that is very, important to me. It's something I take very seriously, and it's one of many reasons why I'm so happy to be with Nuvia. We have separate anesthesia providers. So I'm a dual degree board certified oral and maxillofacial surgeon. I have a medical degree and a dental degree, and I'm board certified. And part of the core training of an oral and maxillofacial surgeon is training in anesthesia. So most of us are, well, actually all of us are certified to do anesthesia. And there are some settings outside of Nuvia. There are some settings where an oral surgeon does the surgery and the procedure at the same time. That's not wrong. We are trained very well to do that. But these procedures are not just like, a short wisdom tooth procedure on a healthy teenager. Many of our patients have some medical conditions, and these are longer procedures. And there's a lot going on in these procedures. There's a lot of fine details. So, in my opinion, I think the best way to have this done is with a separate, highly skilled, dedicated anesthesia provider focusing on the anesthesia. Surgeon focuses on the surgery. Obviously, the surgeon is trained in anesthesia and they're very much aware of every single detail that's going on with the anesthesia. So now you have an anesthesia team, right? You have two people in the room that know about anesthesia, which is great. We also do this in a way where the patients are under general anesthesia, meaning they're completely asleep. So yeah, for all of these reasons, I think that this is a great way to do it.
And you mentioned, an in-house lab. Have you worked in environments where like that's not the case and you've had to like kind of wait on like a set of teeth here, or maybe there's not as much communication going on, or I guess how does the in-house lab work at Nuvia?
Yeah, so there are some places in some different settings. Again, this type of procedure is When a patient's interested in getting this type of procedure and they look online, they're going to see a ton of different places that do this. I mean, there are general dentistry offices that do this. It might be a general dentist that's done like 3 or 5 of them in their whole career, and they want to do the case, and maybe they try to just get through it with some nitrous gas for the patient because they're not credentialed to do anesthesia, or maybe they bring someone into the office to do anesthesia that has been to that office only one time before. There's a lot of different ways that this procedure can be done, but it doesn't mean it's the right way to do it. And to answer your question, traditionally, the bridge, a zirconia bridge, is done by an outside lab in most settings. Most settings that I've seen do not have their own ability to mill a zirconia bridge, especially overnight within a 24-hour time period. So that's something very unique to Nuvia, that as far as everything that I've seen in my experience of being in this full arch space for almost a decade.
And I am curious, can anybody, get this procedure done, or how do you actually know, whether this 24-hour process is appropriate for a certain patient?
Sure. Um, Excellent question. And the answer is, yeah, no, not everybody is a candidate, right? Just like anything else in life. And you want to make sure, for Nuvia and for the patient, it has to make sense, has to be right. But basically, there are ways that we screen patients. We go through certain information. We collect a lot of information. We take a CAT scan. We look at the bone in the jaws, and all these things that will be discussed. But Nuvia has a great 60-second quiz that really helps get things started if a patient's curious about this process and if they want to know a little bit more and find out if they might be a candidate. And there's a link to that 60-second quiz in the description of this video that people can check out.